Hi, my name is Frank Meyer. I'm with the Cornerstone Group, and for the next couple of minutes, we're going to discuss the Affordable Care Act. Sometimes it's referred to as health care reform, other times it's referred to as Obamacare. The Affordable Care Act has already made an immense impact on our nation. Debate over this legislation has driven the election of a president and members of Congress. That same debate has created new alliances on the Supreme Court and nearly pulled the federal government into a cataclysmic default. But now the debate is over, and it's time to learn more about how the Affordable Care Act will impact each of us, our businesses, as well as our employees. Briefly stated, the Affordable Care Act is an absolute game changer. It is going to impact every single employer. It's going to impact every single employee. It will affect every single dependent of those employees. It's going to impact every doctor, every hospital, every pharmacy benefit manager. Every single American is going to be impacted, and impacted in a very significant way by the Affordable Care Act. Make no mistake, this legislation is not health care reform. It's the advancement of a domestic agenda. It's domestic legislation, and it is transformative to our nation. It is strategically taking our country in a very different direction, and it has very little to do with reducing the skyrocketing costs of healthcare. For our purposes today, we're going to be taking a look at the Affordable Care Act from the perspective of an employer, trying to understand the effect it's going to be having on your business in terms of increased costs, and there undeniably will be significant increases in your costs to provide benefits to your employees. There's going to be additional fees, there's going to be additional taxes, there's going to be additional compliance requirements, there's going to be potential costly government penalties, and the indirect costs are very substantial. There's something that can't be overlooked because it's going to take time, lots of time, to understand the complexity of the legislation and the impact of complying with this legislation. And those indirect costs in terms of notification to your employees and the reporting requirements, those indirect costs are traditionally very difficult to measure. However, those are costs just the same. And you're going to want to understand how these costs are going to impact your business model. Before we take a look at how these fines, the fees, and taxes are going to be assessed, the first step is to define your group size. Before you can make these cost determinations we just discussed, you need to figure out if your employee base is a small group or a large group. A small group, simply stated, is any company that has 50 or less full-time equivalent employees. A large group is any employer that has 50 or more full-time equivalent employees. Now, what's a full-time equivalent employee? It's a simple calculation. What you do is you take a look at your full-time employees, and full-time being defined by the president as being any employee who works more than 30 hours per week, and that includes a paid lunch hour. That goes into that calculation. And the salaried employees that you have, they're presumed to be full-time employees. In this particular example, we're going to assume that you have 40 full-time employees, between a combination of employees that are working there more than 30 hours per week, as well as your salaried employees. Now, we have to aggregate the hours that are worked by part-time employees in the month. Let's assume for this example that we've got 25 part-time employees. These employees are working 15 hours per week. That would equal $1,500 a month. You take that and figure and you divide it by 120, which is 30 hours a week times 4, and that gives you a number of 12.5. Now, the way the guidance is written is that you round the number down. So the total full-time equivalent employees that you would have would be 12 employees plus 40 employees. So you would have 52 full-time equivalent employees. So in this example, the employer would definitely be subject to the employer mandate provisions. The mandate provisions kick in, they're scheduled to kick in January 1st, 2015. Now, small employers with less than 50 employees, if you have 50 or fewer full-time employees, then you don't have to offer coverage at all. No requirement whatsoever, no fine associated with this. If you offer coverage, however, you'll want to make sure that the coverage meets the minimum essential value of an approved compliant benefit plan. We'll discuss the details of that shortly. Now, if you're a large employer with the total of 51 full-time equivalent employees or greater, you're going to have to offer insurance. And you're going to have to offer insurance to all the full-time employees. You're going to have to offer coverage to their dependents to avoid the penalties. The coverage must be affordable and provide a minimum value. As I mentioned, these penalties have been delayed until 2015. Now, just to revisit the requirements for a large employer, you must offer coverage to full-time employees. You must meet some affordability tests for the single employee, and then you also have to offer it. You don't have to subsidize it, but you have to offer the coverage to dependents of these employees. Employer penalties are going to be triggered if any full-time employee receives subsidized coverage in an exchange if you fail to meet the shared premium test or the minimum value test. Now, what does affordable and minimum value mean? Well, according to the Affordable Care Act, affordable indicates that an employee's contribution for self-only coverage does not exceed 9.5% of W-2 income. And minimum value means that the plan covers at least 60% of the employee's cost on average. That 60% is called the quote actuarial value of a plan. Now the penalties we'll look at in a quick example of an employer that is not offering coverage at all. Well, the first example, the employer that's not offering coverage is going to have to pay an excise tax of $2,000 times every full-time employee that they have, less the first 30. That means that that tax is multiplied by the number of full-time employees that you have, and you subtract away 30 initially to calculate that onerous tax. Now the tax is an after-tax excise penalty, meaning it's not a deductible tax in comparison to your insurance premiums, which are tax deductible. So the impact of taxes is critical, absolutely critical to understanding how this will impact your cash flow and affect your business. Now, if you are offering coverage and it fails to meet either the affordability or the actuarial value, then the calculation becomes a little bit more complicated. We're a bit skeptical if they're going to be able to actually monitor this component of the test, but let's assume that they are going to be able to have the proper reporting information, that they could administer the fines and monitor the behavior of the employees and the employees that are on and off the plan, and they can get the subsidized coverage, or they go to the exchange and get a subsidized coverage. The employee would receive $3,000 times each employee who does get subsidized coverage if the coverage is either not affordable or does not provide minimum value. Now, let's look at this in closer detail. An employer that's not offering coverage. The first step is, let's take a look at how many employees we have to use as a factor to multiply by $2,000. Hypothetically, let's say we have 400 full-time employees. We subtract out the first 30. That gives us 370 full-time employees. Step 2 is we take the number 370 and we multiply it by $2,000. Step 3 is determining the value, the product, and that would be $740,000 as far as a penalty goes. Now, You might think, hey, that's not bad, but you can't overlook the impact of taxes. They're very relevant, and these penalties are not deductible. And when you're comparing the cost of dropping the plans or paying the penalties, understand the effect of the taxes, both the FICA, the FUTA, the federal taxes, because the insurance premiums are typically pre-tax deductions. And the penalties are not. So to make a apples to apples comparison, you take the $740,000 we looked at before, and then we divide that by 1 minus the employer tax rate. We're going to assume the employer tax rate is 40%, which is somewhat reasonable when you add in the FICA and the FUTA and the state and the federal. So that would give you a fraction of 740,000 divided by 0.6. The cash flow comparison would be $1.2 million. So as you can see here, the penalty can make a significant dent in your bottom line. Now let's take just a minute to clarify the issue and the role of healthcare exchanges that we've heard so much about. Generally, these healthcare exchanges are for individuals that do not have coverage that's affordable, or the coverage does not meet minimum essential coverage, and their income is 400% or less of the federal poverty level. Then the person will be eligible for a subsidy in the form of tax credits, in the form of reduced cost sharing arrangements. And the subsidies reduce the cost to the individual. Now, the state exchanges are not available for employees eligible or enrolled in a qualified employer plan. Now, I say they're not eligible to participate, but employees or former employees certainly will try to participate. There certainly will be those that slip through the cracks. However, they're not going to be eligible for a subsidy at all if their employer is offering a plan that satisfies the two tests we just described. Now, looking ahead at some of the taxes that the Affordable Care Act is going to impose starting January 1st, 2014. The Affordable Care Act has introduced a host of new taxes for a variety of expanding government programs. But suffice it to say that these taxes are going to be anywhere from 3 to 6% of your overall premium. The Affordable Care Act requires insurers to organize their plans into what are referred to as metal levels: platinum, gold, silver, and bronze. This is designed to make plan comparisons easier. All the plans at any given level offer the same coverage, only the premiums and the network of providers may differ. An important distinction among the metal levels are their actuarial values, which are the total average cost for essential health benefits that a plan covers. Plans with higher actuarial values provide more generous coverage. Starting in 2014, all plans that are group plans must have a maximum out-of-pocket set at $6,350 for a single and $12,700 for a family. That's the true out-of-pocket maximum. That includes copays, deductibles, and co-insurances that we discussed earlier. Additionally, small groups have the requirement that they have deductible limits. In addition to the true out-of-pocket, their deductibles cannot exceed $2,000 for a single or $4,000 for a group plans may no longer impose any type of annual lifetime dollar limit on essential health benefits. Now, note that just about any medical service can be construed to fit under essential health benefit of hospitalization or ambulatory patient services. So again, well-intentioned thought, but where it comes to execution, it's going to be somewhat of a daunting task to measure compliance with that provision. There's limits on the number of visits to healthcare providers that are now removed, and you can not have any type of pre-existing condition exclusion. There's Also, a new requirement that you cannot have pre-existing condition exclusions, as well as any waiting period that would exceed more than 90 days for a new hire. So if an employee is hired, they have to be on the plan no later than the 91st day of full-time employment. Now, you also have, this is the first of many compliance requirements that you have to provide your employees. The government is essentially stating that they require you to promote the existence of these marketplaces. The employers are required to provide this, and the written notice was required to be included or distributed to employees by October 1st. The government notice provided no specific instructions what an employee is supposed to do with this notice, other than informing them of the existence of exchanges, as well as the fact that they go to the exchange, they will forego any type of employer subsidy. Now, with all of these changes, start to look for the emergence of additional decision support tools, where you're looking at more pay-or-play analysis scenarios, which will examine dropping coverage and bonusing up executives or salaried employees, or dropping coverage altogether and bonusing up all the employees, what it would cost to buy the insurance otherwise. You'll be looking at decision support tools that will analyze the cost of a defined contribution, where the employer would set aside a certain amount of money each year for each single employee, and that employee can spend the money in a pre-tax basis however way they choose to do so, as long as it is within the framework of an employer-sponsored plan that is meeting the 60% actuarial value test. And then you'll also have some heightened expectations for the agency that you're working with, or the broker or consultant. It's very important that you're going to be partnering up with agencies that have the resources, that have invested the time, that have invested the money into not only purchasing these decision support tools, but also the staff that is capable of understanding how these applications are going to be working, as well as the outcomes of these different scenarios impacting your business. For example, we have an employer impact study, and this is a modeling tool that can tell you if your organization's coverage is considered affordable. It provides a minimum value, and it can look at the pay or play penalties and what the minimum amount is that has to be funded, so you avoid those taxes. And then we also have full-time employee calculators, and because the regulations at this point have remained without clear guidance, it's a little bit difficult to determine the measurement periods, the administrative periods, and the stability periods, and whether certain employees are full-time or part-time. But we'll need to be cognizant of this going ahead, because by 2015 we expect the government will provide clarity with respect to determining these employee status. So that wraps it up this afternoon. We really appreciate the time that you spent, and hopefully everybody's still awake at the conclusion of this. And if you have any questions about the Affordable Care Act, if you have anything that's specific to your company that we haven't addressed today, then please give me a call or email. And there's my cell phone, there's my office line, and if I don't have the answer right then, it won't take too long to research the question to provide you an answer. And don't feel that you have to be one of our clients. If the question is something that's important that you need some clarity on, feel free to give a call anytime. So in the meantime, we wish you well this upcoming year, and stay healthy, stay profitable and compliant, and give us a call anytime you feel we can be of service to you. Thank you very much, and have a great day.